So VITT stands for vaccine-induced thrombotic thrombocytopenia, and that's an extremely rare side effect of the Johnson & Johnson and AstraZeneca vaccines. And what it is it's a very unique syndrome where the body, as in response to the vaccine, starts producing an abnormal antibody known as the anti-PF4 antibody. And what that antibody does is it causes platelets to become uncontrolled, and this results in very heightened activation of the platelets and our coagulation system. And as a result of that, blood clotting starts to happen, as well as low platelets. So the syndrome is really a combination of both blood clots that often occur in very rare locations, such as the cerebral venous sinuses in the brain or in the abdomen, but can also occur in more common locations, such as the lungs and the legs. And in addition to that, is associated with low platelets. So just to explain what a blood clot is first, a blood clot is really a collection of blood cells and coagulation proteins that just clump or stick together in our blood system and obstruct blood flow. And if they occur in the deep veins, they're known as a deep venous thrombosis, or DVT, or if they occur in the lungs, they're known as a pulmonary embolism, or PE. And there's different reasons as to why they occur. So for example, most of the time, blood clots are triggered by a certain triggering event, such as injury, surgeries, or infections. However, there are certain conditions that can predispose people to blood clots. So some of these are known as hereditary thrombophilias, where someone has a hereditary risk for blood clots, but also other things such as high blood pressure, diabetes, obesity, cancer, and other comorbid conditions can increase the risk of blood clots. In the United States, about 900,000 people will get blood clots annually. Out of those, 100,000 actually die from blood clots every year. And that doesn't include arterial blood clots. So blood clots that occur in the arteries, such as heart attacks and strokes, are even more common. And about 1 out of 4 deaths are due to conditions related to blood clots. While there's a lot that we still do not know about it, but over the past few months, we've come to learn a lot about it from research that's ongoing and all the reported literature. And in the United States, the most recent update from the CDC reports that there's been 35 conditions so far. In Europe, it's more than that. And the most recent data from the UK, which is the most reliable, shows us about more than 300 cases that have occurred. Of course, this is out of a very large number of people who've received the vaccine. So up to date, there's been at least 10 million who've received the Johnson & Johnson in America. So it's a really small percentage who've developed this syndrome. And what we do know is that, although this is rare, this is a serious condition, as it can result in blood clots. And earlier on, it was associated with significant death rates. However, now that we've come to know how to recognize it, and now that we've come to know how to treat it, this has become more readily manageable and better recognized by physicians and patients. So we've only been seeing this with the adenoviral vector vaccines. So that's the AstraZeneca and the Johnson & Johnson. Now, the mRNA vaccines, this is not something that's been described as a side effect of the mRNA vaccines, meaning Pfizer and Moderna. There was one single case that was reported, in the past few days by the CDC as a result of Moderna. We don't have details about it or any additional information, but this is, 1 out of more than 300 million so far who have received the mRNA vaccine. So this is an astronomically unlikely scenario. Not all blood clots are the same, and VITT is a very unique entity because it's caused by a pathologic or problematic antibody that the immune system produces and results in a very heightened activation in the coagulation system. So this is a syndrome that leads to a very heightened risk for blood clots that is ongoing for as long as that antibody is there. And in addition to that, also leads to low platelets, which in some cases can cause a bleeding problem. In regular blood clots, we don't see this antibody. So usually there's an inciting event, we give anticoagulation, meaning blood thinners, and that's how we manage them. However, this condition, because it's resulted by an antibody, often requires immunosuppressing agents such as steroids. We do often want to emphasize that although this is a serious condition and can be life-threatening, it's exceedingly rare. So the data that we have that comes from the CDC so far tells us that out of around 10 million people who have received the Johnson & Johnson vaccine, there has been only 35 cases in America. So that's an incidence of about 2 to 3 per million. Now, we do know that certain groups may have a slightly higher risk than others. So we know that younger people, ages 20 to 50, may be at higher risk than older people, and particularly women as well. And in that group, the incidence is about 10 or so per 100,000, which is still exceedingly rare, but it's something that has warranted the CDC to issue sort of a warning for these groups. So, the initial cases of VIT in Europe and in America, did show us a high mortality rate. So, there were a lot of deaths, so anywhere between 10 to 20%. And just to remind people that at that point in time, we really didn't know what that is. So we're talking about a brand new syndrome here, a brand new condition that no one has seen or described before, and it was a very unique phenomenon. So early on, people didn't know what was going on or what to do about it. But this has changed. So now we are recognizing this better. And there is new data emerging showing that, the death rates are less significant than before. And probably this is because we're recognizing this better. So the first thing, I tell patients is to look out for symptoms that are worrisome. So this includes severe or persistent headaches, chest pains, trouble breathing, leg swelling or leg pain in the lower extremities, severe abdominal pain, seizures, confusion, vision changes. All of these symptoms, warrant a evaluation by a physician. So just call your doctor or go to an emergency department, and then you can be tested for this condition. And now we know how to treat it with specific anticoagulants that are not heparin, which is believed to make the condition worse, in addition to steroids in certain cases, and an infusion of antibodies called intravenous immunoglobulins. Because whenever something like that happens as a result of vaccines, it does cause worry or panic among the public. And what I always tell people is that you have to weigh the risks and the benefits. So in many parts of the world, the pandemic is still going on very strong. There's a lot of cases of COVID. There's a lot of illness, and even in America, even though things have been getting better, there's new variants such as the Delta variant that are becoming more worrisome. And so COVID itself has a much higher risk of causing problems or death or even blood clots itself than the vaccine. And as a reminder, we're talking about single to double digits out of a million probability of having a side effect from the vaccine. So weighing those risks and the benefits, it's clear to me and to all the sort of major institutions that the risk of developing a side effect from a vaccine is far, far, far less likely than the risks that could happen as a result of COVID infection. There has been an association between COVID-19 infection and blood clots that we have recognized very early on in the pandemic. And I've published a review article on the topic called The Hypercoagulable State of COVID-19 that details this. But basically what we came to witness very early on in the pandemic is that patients with COVID, specifically those with severe COVID, have been developing severe blood clots and These include blood clots in the deep veins or pulmonary emboli, meaning blood clots in the lungs, and even strokes and heart attacks. And this has been a feature of severe COVID illness, particularly those in the intensive care unit, but also those with moderate illness, so those who are in the regular hospital wards and not in the intensive care. And it was estimated in early data that the very severe COVID cases had a incidence of blood clots anywhere between 20 to 40%, which is very high. And those with maybe milder or moderate illness in the hospital, that rate was anywhere between perhaps 3 to 9%. So, which is still significant. And when you compare that with the risk of 2 per million or 20 per million, that there's a clear distinction there. Now, the blood clots that happen to COVID are different from VIT, so it's not necessarily the same syndrome that causes low platelets and requires immunosuppression, but it is a blood clot at the end of the day, and many times this can have serious effects on the patient and can be fatal. So the blood clots that we've seen with COVID can occur, first of all, in veins and in arteries. So arterial blood clots are more dangerous because they can lead to strokes or heart attacks or even limb loss. But also we see them in really any part of the body. So we've seen blood clots affecting any organ of the body. The most common ones, however, are the deep venous thrombosis, so blood clots in the legs, and the ones in the lungs. But yes, as you correctly mentioned, they can really occur at any part or any organ in the body. Some patients with COVID die because of the blood clots, but others die because of the effects of the illness itself on respiratory failure or strokes or heart attacks that lead to other complications and result in death. And as in the beginning of the pandemic, when this was occurring, I think the mortality rate was higher. So many more people were dying because of COVID or because of the blood clots it's causing, because it wasn't a phenomenon that was very well recognized. But as time has went by, our management of COVID has improved. And as a result, the recognition of blood clots and the prevention of blood clots has improved. So this is definitely something that we've made progress on comparing to how things were at the beginning of the pandemic. So patients who get blood clots as a result of COVID-19 infection are usually patients who have severe COVID illness, meaning they're in the intensive care unit or they have respiratory failure or requiring high amounts of oxygen. Also, patients who have underlying risk factors for blood clots, such as a previous history of blood clots, or hypertension, diabetes, obesity, or a hereditary blood clotting disorder, or cancer. So all of these conditions make people who get infected with COVID-19 infection at a higher risk of developing a blood clot. We've come to recognize that treatment with intravenous immunoglobulins, which is an infusion of antibodies that we use for many disorders of abnormal antibody production, in addition to steroids, which are immunosuppressants, as well as anticoagulants that are not heparin. So we've come to recognize this combination or this regimen as an effective treatment. And what this usually does is it, in most cases, resolves the condition and normalizes the platelet count and prevents further blood clotting to happen. So with blood clots, people often think of blood thinners as medications that dissolve the blood clots, but they're not. So what blood thinners do is they prevent further blood clots from happening, or they prevent that existing blood clot from getting worse or bigger and traveling to other places. So what usually happens is we give blood thinners to prevent other blood clots, but then the body takes care of the existing one and dissolves it on its own with its usual mechanisms. So in most cases, with time, the blood clot will dissolve, and that could take anywhere between weeks to months sometimes. And then the patient is on a blood thinner for a certain duration based on the cause and the nature of the blood clot. And that's usually the mainstay of treatment of regular blood clots, not VIT. So in general, based on the International Society of Thrombosis and Hemostasis, any abnormalities that occur anywhere between within a week to 4 weeks of getting the vaccine are considered to be related to that vaccine. So usually that's the time period that we worry about. Now with AstraZeneca, it's a little more complex because it's 2 doses, and there have been reports of VIT occurring after the 2nd dose. So that tells us, that there may be a longer duration for which the effect can be seen. But most of the time, at least based on the CDC data that we have, this is something that occurs on average after about a week or 2, but can be anywhere up to 4 weeks. So based on what we know about VIT and its relation to Johnson & Johnson or AstraZeneca, this hasn't been described in these long durations. However, we still continue to learn about this, and this is still fairly new. So we've only known about VIT since March, and we've only seen a handful of cases. So this is something that may change, but as far as we know now, it's unlikely for it to occur after long periods of time, meaning months after the vaccine. But that's something that may change. But as of now, it's something that we recognize that happens usually in a week or 2, but up to 4 weeks after the vaccine. As for COVID, a lot of different factors play into that. So, patients who've had prolonged hospitalization or require surgeries or are immobilized or have underlying risk factors such as history of blood clots or obesity, diabetes, or other medical conditions that predispose to blood clots. These patients may be at risk of blood clots occurring maybe at a more extended duration of time. But again, this is very variable based on the illness and the type of patient. So symptoms that make us worry about blood clots in the brain include headaches that are usually severe or persistent or different from usual headaches in patients who have migraines, visual changes, seizures, confusions, or vision changes. All of these things make us worry about a blood clot occurring in the brain. And then any symptoms of chest pain or trouble breathing or fast beating heart rate, these make us worry about the blood clots in the lung. And then leg swelling or leg pain or redness or tenderness in the leg make us worry about DVTs or deep venous thrombosis in the lower extremities. And then there's other unusual locations of blood clots, for example, in the abdominal vasculature. So severe abdominal pain or nausea or vomiting. So all of these symptoms I've just described are things that make us worry about a possibility of a blood clot. It doesn't mean that it's a blood clot, but it does warrant further investigation. And usually just a blood test in the beginning or an imaging study to look for a blood clot is the first step, and it helps us rule it out or rule it in. So there's a lot of resources. So the World Health Organization and the CDC and the Mayo Clinic all have online articles that talk about this in more depth. In particular, the CDC does have a very great infographic about blood clots in America, as well as its association with COVID-19 infection, and the separate one about its association with the vaccine. So I do recommend checking the CDC resources that are very helpful. And in addition to that, there's a lot of things that spread on social media, on Facebook and Twitter and memes that are often questionable. So I always encourage people to go to the original source and only go to reliable sources, such as medical journals or physicians who are talking about this on social media and so on, and not sort of believe everything that's shared through memes and graphics, and you know how it goes. So yeah, all these resources, including the CDC or any physicians or organizations that are trusted, are reliable.